Crohn's disease is just not a chronic diarrhea. Now remember, Crohn's is a chronic immune-mediated inflammatory disorder that can affect any part of our GI tract, most commonly the terminal ileum. It is very important. Now remember, in genetically susceptible patients, the immune system loses tolerance to the normal intestinal bacteria. Now, instead of your regulated defense, you get the persistent activation of something called the T helper cells. These are mainly the Th1 and the Th17 pathways. Now, these cells release inflammatory cytokines, especially the TNF alpha, the IL-12 and the IL-23. Now, these amplify macrophage and neutrophil recruitment. Now, the result is sustained inflammation. The inflammation is transmural. It extends from the mucosa through the submucosa into the muscular layer and outward towards the serosa. So that depth separates it from the ulcerative colitis, which is limited to the mucosal surface and spreads continuously. Now, Crohn's is patchy skip lesions with normal bowel between diseased segments. Now, because inflammation penetrates the full thickness, structural complications end up developing. Patients may see the non-caseating granulomas, bowel wall thickening, luminal narrowing from the fibrosis, fistula formation, intra-abdominal abscess. It is very important physiologically. Please, let's think function over here. Now, when that terminal ileum is involved, vitamin B12 absorption decreases, bile salt rate absorption decreases. It is very important. Now, that leads to something called macrocytic anemia, fat malabsorption, steatorrhea, weight loss from chronic inflammatory catabolism. Now, clinically, patient present with chronic diarrhea, right lower quadrant abdominal pain, unintentional weight loss, fatigue. Now, sometimes they end up having the low-grade fever. So Crohn's, remember, the behavior is categorized into inflammatory type, that is the active mucosal and the transmural swelling. The structuring type, that is the fibrotic narrowing causing obstruction. The penetrating type, that is the fistula connecting bowel to bladder, skin, or other bowel segment. Now, diagnosis is confirmed with colonoscopy, biopsy. Now, imaging such as CT or MRI enterography, these evaluate strictures, abscesses, fistula. Remember, inflammatory markers like the CRP are often elevated during flare-ups. Now, there is no real cure over here. I want you to understand the goal is immune control and remission maintenance. Now, corticosteroids are used for acute flare-up suppression. Also, immunomodulators reduce long-term immune activation. Now, biologic therapy, particularly anti-TNF agents, these target the cytokine signaling to decrease inflammatory progression. Now, surgery is reserved for complications such as obstruction, perforation, uncontrolled abscess, but recurrence can occur in other segments. Now, Crohn's disease, I want you to understand it clearly. This is a chronic immune dysregulation that penetrates the bowel wall. It also disrupts nutrient absorption, and progressively it alters intestinal architecture if not controlled well. Now, this is not a simple irritation. This is an immune-driven structural disease. Always gather my thoughts, my research, and I come here to relay my little information to you. I'm still learning from you. We are still learning from each other. I'm going to see you soon. My name is Marcel.